Well, one thing we've learned the past year with COVID-19 is that it seems to affect everyone differently. The Centers for Disease Control and Prevention says long-term effects of the virus include fatigue and shortness of breath. However, more medical experts are starting to see something that affects people's physical appearance: hair loss. I looked into why this is happening and what to do if it happens to you.
I have thick hair. It never falls out. And you could just do this in the shower, and it wasn't little pieces, it was long clumps of strands.
This is what Lisa Gatling of York County started to see on a daily basis 2 months after she got sick with COVID-19 last July.
Your hair is just like your crown. And when you start to, I was like, oh my God, I'm going to go bald.
And she isn't alone. I got this email and photo from a viewer saying, "I had COVID in November and am now experiencing massive hair loss. Freaking out." So before you freak out, let's first find out why this is happening. For that, we asked a WellSpan dermatologist.
It's a condition called Telogen effluvium, where essentially what happens is a major illness, stressor, or event just shocks the body to the point where the hair follicles are off cycle.
Put simply, it's when more hairs than normal enter the shedding phase of the growth cycle at the same time. Most people start to see their hair fall out in clumps 2 to 3 months after being very sick, especially if they had a fever.
We are seeing a record number of cases than we usually see in this time.
However, COVID-19 is not the only root of the problem. Add stress to the list.
I think we can all agree that, stress levels are a little bit elevated in this pandemic. So a lot of people are coping differently, and that stress is actually been manifested in this form of hair loss called telogen effluvium.
There are many ways to lower stress, and she says there are also several topical and oral medications that can help. Many people instead opt to conceal the problem with a wig. However, hair loss has become so common the past year that one wig maker I talked to said they can't even keep up with demand because of a huge hair shortage.
We have the regular population of people who usually use hair wigs and camouflage, such as the cancer patients. And now we're adding a new population of people who, either have recovered from the COVID-19 infection or, again, are dealing with this pandemic stress related.
In some cases, it can take up to 9 months before the hair shedding stops.
Now it's just starting to grow back, so I have like little tiny pieces everywhere.
But rest assured, it will continue to fill in.
Time is your best medicine. And some people are worried. The main worry is that, am I going to go bald because my hair is shedding, it's thinning, I just don't want to be bald. And so just a simple reassurance that time will eventually kind of reset the clock on the hair follicles and the cycles.
And it will grow back. So experts also say it's important to be kind to yourself. Stress only makes hair loss worse. We've put a list of ways you can de-stress, as well as some of those topical or oral medications that can help with COVID-19 hair loss on our website, fox43.com.